I am Alessandro Biglioli. I'm the CEO of Elsius Biomedical. We do an ECMO system. So for people who don't know what it is, ECMO stands for extracorporeal membrane oxygenation. It's a system that basically takes the blood out of a patient's heart, it pumps it, oxygenates it, and puts it back in real time. So it's a cardiopulmonary assistance system. So why ECMO? Why are we doing ECMO? Because the main reason is the impact on patients is dramatic, especially lately. I have 3 cases here. This is a woman that lived 6 days without lungs on an ECMO machine because she had issues. She had cystic fibrosis. She was waiting for a transplant, and she had a severe sepsis, so they had to take the lungs out, and she was able to recover fully. This is a guy who basically died of hypothermia. He stayed 10 hours in 4 degrees temperature, was found by his father in the morning. He was able to come back. And this is a kid that stayed 41 minutes underwater, was found at the bottom of a lake in Austria and was able to come back. What is interesting is none of these people had any brain damage, which means that ECMO allows to do things that right now is the only technology basically that allows this kind of cases. So why is not used more, right? Well, the patients come, where do they come from? So they come from emergency, cardiac arrest, drownings, hypothermia. We're a Canadian company, so hypothermia is a big thing for us. Fumes inhalation, severe trauma, post-cardiac surgery, neonatal, that's where ECMO comes from originally, so premature babies. Respiratory, COPD, for example, is a big thing now because you can use ECMO to do decarbonization, which can be done outside of the ICU. And then bridge to transplant. These are long-term ECMO patients. Some patients can stay 9 months under an ECMO machine. So what are the issues? Coagulation, main issue. These patients need to have a very high systemic heparinization. Versatility, you need to use it for different patients, different diseases, and then transportation. This is a patient inside a military plane being transported under ECMO. He doesn't have only ECMO issues, but you can see the complexity, and that's a patient inside an ICU being deambulated under ECMO. That's just ECMO. So what is our approach? We developed for coagulation a new biocompatible coating that reduces the inflammatory response and reduces the coagulation. This is our fibers against the main competitor. You can see there's no starting of coagulation cells adhesions. Flexibility, this has a very low priming volume. You can see the size of our device. So this goes to a console, but the console is as big as a computer. Then position, our device can stay upside down, any place close to the patient. And then the operation is very easy to use. It has basically only one knob. As we said, the blood pump and the oxygenator are integrated. We did some tests with the military. This is, you can see the device between the legs of the patient. This is being transported. There's also a ventilator, but it's transportable basically. So the opportunity, the impact, we have seen the impact on patients. ECMO can do things that no other technology can do. The market is growing everywhere. Right now is about $1.5 billion. There are projections to go to 20 billion in about 10 years. The team, we are very experienced. We have been in ECMO and in blood oxygenation since the 90s. This is my 14th startup, so I've been doing it quite a bit. The risk, the device has been de-risked a lot because the R&D has been done. We are in preclinical, we already done 40 animals. The timeline, in a year and a half, we can be on the market if we get fully funded. And then the return on investment, well, you can talk to me if you're interested about that. So this is a state-of-the-art ECMO system, and then it has the possibility of becoming the standard of care for ECMO. So it's an interesting proposition. It's worldwide, so ECMO is growing everywhere. Everywhere we go, there's more and more cases. This is reflected in the fact that our investors come from all over the world. We have people from Singapore, from Europe, US, Middle East, you name it. So we have been recognized, we have worked with a lot of institutions in the US, in Japan, in China, in Canada. So there's a lot of interest, basically. So thank you very much, and I'm open for your question.
Thank you, Alessandro.
Thank you so much. So what stage of production are you at right now? How much testing have you done? How much validation does it need?
Yeah.
And what what other things do you have to go through in terms of regulation and things like that?
So we are preclinical. We have done 40 animals. In the US is a class 2 and is a 510K. We talked to the FDA. There shouldn't be any patients required for the US. In Europe, we worked with UV in Germany. They said probably 15 to 20 patients. And then in other jurisdictions, it depends. In China, for example, is a class 3, requires a little bit more. But for example, China is a big market and there's no ECMO manufacturer. So there's a big opportunity we feel over there. So it depends. But US is a class 2 510K basically, with a predicate device already identified. Yep.
Thank you for your presentation. How much of, I guess I'm asking where in the picture of that ECMO machine does that replace it? Does it replace the whole thing or what portion of it?
So this replaces
device?
sorry, maybe we should go back, but this replaces the pump and the oxygenator,
Okay.
which in an ECMO system, basically you have a driver of the motor,
Yeah.
the motor that drives the pump, you have tubing that goes to the oxygenator, and then you have a gas exchanger that goes there, and maybe a heat exchanger, and then with all their controller. We integrate everything. So ECMO, there's a disposable cartridge, which is this one, that goes into a motor, and then a console. So it replaces everything with this plus a computer, basically.
Do you know if there's any other competitors that are creating something similar?
There are. So the market is dominated by one company called Maquet out of Germany. I think they have about 85% of the market. It's difficult to get market data on ECMO. And it works, but if you talk to any emergency doctors, there's a lot of complaints about it, especially because it's big, it's bulky, and it's not that easy to use.
Great presentation. Could you let us know about the cost of your product versus the standard right now?
Yes. So the cost will be the same as what they have now on the market. What is happening with the coating is really the main thing, because if you can reduce the heparinization and the inflammatory response, basically you can keep the patients less in the hospital. We have done tests with human blood, so you can reduce the time in the ICU by about 50%. It depends on patients, of course, but that's our projection. So an ECMO patient costs about $1 million to a hospital. So if you can reduce that cost to the hospital, the price of the device basically is less relevant. So we try to keep it in line with everybody else, but we are reducing the cost to the hospital significantly.
Thank you.
You mentioned a couple of trials that you did on animals. Was this trials to make sure that the device works as an ECMO machine, or were they on the coding that you have?
So, both. So we published a paper on the coding, and we did, animal tests, of course. And we are doing an economic study at the Texas Medical Center in Houston at Baylor St. Luke's. So we are trying to cover all the bases. Okay? Thank you very much.
Thank you, Alessandro.